the big picture of people who suffer from varicose veins, the actual term for the diagnosis is venous insufficiency. That means that either because of family history, grandparents or mother, or because of pregnancy in women, that's a big thing, hormone use in women. There's a tendency for the veins to not work so well over time. And so venous insufficiency is when the veins in the legs are not able to work and bring the blood up to the heart as they should normally do. And that's why sometimes varicose veins will form, veins will become bulgy, dilated, and there is heaviness, swelling in the legs, and they don't look nice. There's the usual traditional sclerotherapy, which is using a needle and injecting a medicine that is gonna basically burn the vein from the inside out. But it's usually done for the smaller veins. And then vein ligation used to be done for the big veins, usually in the inner leg, from the groin to the knee or down to the ankle. And there are new procedures and new techniques to try to take care of those veins, in fact. And the procedure that has been commonly done nowadays is something called endovascular laser ablation. It's mainly designed for the saphenous vein, which is really a big cord-like vein in the inner leg. It's the same vein that heart surgeons use for bypass surgeries. And these are the veins that are usually the ones that cause more pain and sometimes phlebitis. They should be asking about the experience of the physician doing the procedure, especially if it's a catheter ablation. They should be asking about the risks of infection, the risks of inherent to the procedure, whether there's going to be pain, anesthetics will be given or not. And I think the most important thing is they should ask whether their symptoms really match the procedure that is being indicated to them. You know, a lot of times people go with the expectation that they're going to have a procedure, whether it's a laser treatment of a spider vein or ablation with catheter or even vein stripping surgery, and they're going to think, okay, I'm not going to have swelling of my leg anymore, it's not going to hurt anymore, I'm no longer going to have this vein visible, so I'm going to get rid of that. And these procedures do get rid of the veins, so the cosmetic effect is always there. But other veins may start appearing later on, and oftentimes before procedures like a catheter ablation, patients need to undergo a detailed ultrasound of the veins of the legs, usually an ultrasound from the groin to the ankle, looking at all the veins to make sure to basically evaluate all of them and first of all see whether the procedure is technically feasible and indicated, and second of all whether they can predict whether it's going to be successful or not.